Welcome to another video on Body's YouTube channel. Have you ever experienced a burning sensation in your chest or throat after a meal? You might have encountered heartburn, GERD, or acid reflux. Now you might be wondering, aren't they all the same thing? While they're closely related, they are indeed different. Let's break it down. Firstly, heartburn. Despite its name, it has nothing to do with the heart. It's a symptom of acid reflux, where stomach acid or bile irritates the food pipelining. This causes a burning sensation in the chest, which can be mistaken for a heart attack. It's usually triggered by certain foods, alcohol, or lying down too soon after eating. Next up, acid reflux. It's a common medical condition where acid from the stomach moves up into the esophagus, causing discomfort. If it happens occasionally, it's generally not serious. However, if it occurs frequently, it could lead to GERD. And that brings us to GERD, short for gastroesophageal reflux disease. It's a chronic, more severe form of acid reflux. It can lead to complications like esophageal stricture or even Barrett's esophagus, a precancerous condition. So how can you tell if what you're experiencing is heartburn, acid reflux, or GERD? Well, common symptoms include a burning sensation in the chest or throat, a sour or bitter taste in the mouth, and difficulty swallowing. But if these symptoms persist more than twice a week, it might be GERD. Remember, if you're ever in doubt, it's best to consult a healthcare professional. They can provide a proper diagnosis and suggest suitable treatment. It's also important to note that all three conditions are manageable, and changes in diet can play a significant role in reducing symptoms. So, don't worry, we're not leaving you in the lurch here. Now that we've understood what heartburn, GERD, and acid reflux are, let's delve into the remedies. What if I told you that your kitchen might hold the key to relieving these uncomfortable symptoms? Yes, you heard it right. Certain foods can play a significant role in alleviating the symptoms of heartburn, GERD, and acid reflux. Let's dive straight into it. First up, we have ginger. This root has been a cornerstone in medicine for thousands of years. Known for its anti-inflammatory properties, ginger can soothe the stomach and reduce acid reflux symptoms. You can incorporate ginger into your diet in a variety of ways, such as adding it to your meals or drinking it as tea. Next, we have oatmeal. This breakfast staple is not only delicious but also packed with fiber. Fiber can absorb stomach acid and reduce symptoms of reflux. Plus, oatmeal keeps you full, preventing overeating and subsequent reflux. Moving on, let's talk about non-citrus fruits. While citrus fruits might trigger reflux symptoms, non-citrus fruits like bananas, melons, apples, and pears can actually help soothe your stomach. These fruits are low in acid and high in fiber, making them a great choice for those suffering from heartburn and acid reflux. Now, on to lean meats. Foods like chicken, turkey, fish, and seafood are low in fat and can reduce symptoms of acid reflux. Remember to cook them without a lot of added fat. Grilling, broiling, steaming, or poaching are all good methods. Finally, healthy fats. Foods rich in healthy fats like avocados, walnuts, flax seeds, and olive oil can help reduce inflammation in the stomach and help control symptoms of acid reflux. But remember, moderation is key here. It's important to remember that everyone's body reacts differently, so what works for one person may not work for another. It's all about finding what works best for you. Food is not just about satisfying our hunger, it's also about healing our bodies. Remember, what you eat can make a significant difference to your comfort. So, take a moment to evaluate your diet and see how you can incorporate these foods to help manage your symptoms. It's time to turn your kitchen into your own personal medicine cabinet. Knowing what to eat is only half the battle. The other half is knowing how to eat it. Eating for optimal digestive health isn't just about the food choices we make, it's also about how we consume these foods. So, let's dive into the best ways to consume foods that help alleviate heartburn, GERD, and acid reflux symptoms. First, consider eating smaller, more frequent meals throughout the day. This can prevent your stomach from becoming too full, which can lead to increased pressure and a higher risk of reflux. Instead of 3 large meals, aim for 5 to 6 smaller meals spaced evenly throughout your day. This not only keeps your metabolism active but also helps in maintaining stable blood sugar levels. Next, make sure you're not lying down immediately after eating. When you lie down, gravity is no longer helping to keep your stomach contents down where they belong. This can lead to acid reflux and heartburn. So, try to stay upright for at least 2 to 3 hours after eating. This might mean adjusting your meal times or rethinking your late-night snack habits. Drinking plenty of water is another crucial factor. Water aids digestion and can also dilute stomach acid, reducing the risk of heartburn. However, avoid drinking large quantities of water during meals as it can dilute the digestive juices, slowing down the digestion process. Instead, sip small amounts during meals and drink more water in between meals. Chewing your food thoroughly is also important. It might sound simple, but taking the time to chew each mouthful properly can make a huge difference. It breaks down the food into smaller particles, making it easier for your stomach to digest. Plus, it gives your stomach more time to signal to your brain that you're full, helping to prevent overeating. Lastly, don't rush your meals. Take your time to enjoy each bite. Eating quickly can lead to swallowing air, which can cause bloating and increase the risk of acid reflux. Remember, it's not just what you eat, but how you eat it that can impact your health. Beyond food, there are other important factors to consider when tackling heartburn, GERD, and acid reflux. Our lifestyle plays a significant role in managing these conditions, and making certain modifications can make a world of difference. Let's start with maintaining a healthy weight. Excess weight puts pressure on the abdomen, pushing up the stomach and causing acid to back up into the esophagus. Therefore, maintaining a healthy weight can reduce the risk of acid reflux and heartburn. Regular physical activity and a balanced diet can help achieve this goal. Next, let's talk about trigger foods. Certain foods and drinks can exacerbate acid reflux and heartburn. These typically include spicy foods, fatty foods, coffee, alcohol, and carbonated drinks. It's important to identify your personal triggers and try to avoid them as much as possible. It's not about completely eliminating these foods and drinks from your life, but rather about moderation and mindful eating. Now let's move on to sleeping habits. Did you know that the way you sleep can affect your digestive health? Lying flat can cause stomach acid to flow back into the esophagus, leading to heartburn and acid reflux. An easy solution is to elevate the head of your bed by 6 to 8 inches or sleep on a specially designed wedge pillow. This can help keep acid in the stomach where it belongs. In addition to these lifestyle changes, it's essential to manage stress levels. Chronic stress can negatively impact your digestive system and trigger symptoms of heartburn, GERD, and acid reflux. So consider incorporating stress management techniques such as deep breathing, yoga, or meditation into your daily routine. Lastly, don't forget to stay hydrated. Drinking plenty of water throughout the day can help dilute stomach acid and reduce the risk of heartburn. Sometimes the best remedy is a change in habits. And remember, it's never too late to start. We've covered a lot today, from understanding heartburn, GERD, and acid reflux to remedying them with the right food and lifestyle changes. Let's do a quick recap. We started by unpacking the mysteries of heartburn, GERD, and acid reflux, conditions that are more common than you might think, but often misunderstood. We learned that these conditions are not just about discomfort, but can lead to serious health complications if left unchecked. Then we delved into the world of food, discovering that the old adage, "You are what you eat," rings true, especially when it comes to digestive health. We learned about foods that can help alleviate the symptoms of these conditions. Foods like bananas, oatmeal, ginger, and lean meats, to name a few. Foods that are not only delicious but also have the power to help soothe your digestive system. Next, we explored the best ways to consume these foods. It's not just about what you eat, but how you eat it. Small, frequent meals can be easier on your digestive system than 3 large meals a day. And remember, it's always a good idea to stay upright for a couple of hours after eating, to help prevent acid from rising up into your esophagus. We also highlighted the importance of lifestyle changes for better digestive health. Regular exercise, maintaining a healthy weight, and avoiding triggers like smoking and alcohol can all contribute to managing these conditions and improving your overall health. It's a holistic approach, encompassing not just your diet but your entire lifestyle. So, as we wrap up, remember that the power to manage these conditions lies in your hands. With the right food choices and lifestyle modifications, you can significantly improve your digestive health and overall well-being. In conclusion, the journey to better digestive health is one that involves awareness, the right diet, and a commitment to a healthier lifestyle. With the right knowledge and actions, you can take control of your health. So here's to happier, healthier days ahead. Before we wrap things up, we want to remind you of a few ways you can support our mission to promote better health. If you found this video helpful and informative, please give it a like. This helps us understand what kind of content you find most useful. Also, consider sharing this video with others in your life who might benefit from it. You never know who might be struggling with heartburn, GERD, or acid reflux, and could use the tips and strategies we've discussed today. And if you haven't already, make sure to subscribe to our channel. We're always creating new content about health and wellness, and we'd love for you to join our community. Lastly, don't forget to hit the notification bell. By doing so, you'll stay updated on all our new videos, ensuring you never miss out on crucial health information. Thank you for watching, and remember, your health is in your hands. Here's to happier, healthier days ahead.